Well, it's time for our health report, and joining us now is Africa 54 health correspondent Lino Budul with some new information on Ebola. Lino.
Hello, Vincent. Hello, everyone. United Nations Children Agency UNICEF has launched a new open source app store for international development known as Rapid Pro. Rapid Pro pulls together other applications into one easy-to-understand bundle ready for governments, large organizations, and others to deploy anywhere in the world. The app has been developed in collaboration with Nyaruka, a Rwandan software firm. UNICEF Executive Director Anthony Lake says the new app is being created to be used in Ebola control strategies.
We are developing now something called mHero, which I'm excited about, which is being developed for Rapid Pro, and we're going to use for when we get it in, for the Ebola response, and it will allow us then to check on how the health centers are doing, and check daily on the health of the community health workers.
Nigeria has done well, thank God, in containing the Ebola virus. And today there is no case. We had 19 cases, 7 deaths, the rest recovered, no case. How did it happen? Massive communication. We used the mobile telephony to send out SMSs, the government did, to those 125 million lines.
UNICEF, along with other international organizations, is actively working on the ground to contain the Ebola outbreak. Joining us on the phone for more insight is Sheldon Yett, a UNICEF representative in Liberia. Mr. Yett, welcome to the show.
Thank you. Good to be with you.
It's good to have you. Listen, can you give us an assessment of the situation presently?
It's a very poor line, but I think you're asking me about the situation. And unfortunately, the situation continues to deteriorate. Every day we have more and more cases, and we know the caseload is doubling every 2 to 3 weeks. So unfortunately, all of us have a lot more work to do in the weeks to come.
And we've seen that many children are being orphaned by this outbreak. What is being done with these children for them to care for them?
Yes, absolutely. The number of orphans keeps increasing, of course, as the number of people infected by the disease increases by the day. And the vast majority of Liberians are taking care of children and are working, doing everything they can to ensure that these children are with a loving family. But one of the things that we are facing with this disease is stigma. And unfortunately, they are a minority of families, a minority of communities who are rejecting children. And we need to ensure that people understand that children who have survived the disease are not pose any danger to anybody else, and that, of course, all children need to be with families, and we need to ensure that there are mechanisms in place to support families who are caring for these children.
And you are providing help to these children, but you're also providing help to adults. Can you tell us about some of the services that you are providing?
Of course, when you're dealing with an epidemic large as this one, it's important to address it on all fronts. We're bringing in hundreds of tons of supplies. To date, we've brought in over 300 tons of basic health supplies that have been distributed to all corners of the country. Supplies for disinfecting health centers, supplies for keeping health workers safe, basic supplies for rehydration. We've got teams going door to door, again, every corner of the country, making sure that people understand what the risks are and how they can keep themselves safe. We're working with our government counterparts, so in the lead, for putting together new protocols, new ways to deal and to address the needs of children who have been orphaned by this disease. We're working on new protocols for nutrition. We're trying to address this on every imaginable front, and we're doing it hand in hand with our partners and, of course, with our government counterparts in the lead.
And Mr. Sheldon, yet very quickly, moving forward for UNICEF, what is the most critical aspect? Very quickly.
Well, right now it's really important that we get the Ebola treatment units up and running. It's wonderful that they're being constructed, but it's essential that we have trained staff in there. The sooner we can get these Ebola treatment units that provide the best care possible in the country, the better. So we've got to get them constructed, and we have to have them staffed. And we're working with our partners to ensure that happens.
Thank you so much, Mr. Sheldon Yett. And that was Sheldon Yett, UNICEF representative in Liberia.